pioneering system of pain relief, which means that patients can go home just a couple of hours after their surgery, is being trialled at hospitals in Hull and East Yorkshire. It works using ultrasound and means that patients can deliver the anaesthetic themselves. Well, the system is the first of its type in the country and could save thousands of pounds for the Hull Royal Infirmary by reducing bed stays and also helping patients to recover in their own home. Crispin Rolfe has this report.
Numbing the pain, a key part in any operation, and today keen sportsman Sam is having surgery on his knee. But the 14-year-old will be recovering at home thanks to pioneering pain control, which relies on finding and numbing the nearest nerve using a fine tube.
I use the ultrasound machine, I locate where the nerve is, and then I insert a special type of catheter through which I pass a tiny amount of current. And that current gives you a twitch of the muscles supplied by the nerve, and that gives me a 100% success rate.
Normally this operation would require 3 days in hospital, but the new technique allows patients to control the pain at home, with the added benefit of freeing up hospital beds and saving money.
Per patient, hundreds of pounds really in terms of savings, but obviously until we determine the number of patients that this could have a positive impact on, that will run into thousands of pounds in savings. Not only that, but it allows us to better use our inpatient capacity for the more complex cases that actually need a hospital inpatient stay.
Sam's just woken up to a regional nerve block. It'll freeze the nearest nerve to his knee for the next 80 hours using the tube inserted earlier. From there, he can control the pain.
We can either alter the rate that it's flowing at, or we have ones that you can have a bolus dose as well, where they can just press it once and then it locks out, so they can't overdose basically, they can't give themselves too much. It's absolutely fine. The fact that he's gone back to sleep, I think, is very comfortable.
We used to use opioid-like medication to control pain, but now with this technique we don't have to use opioids at all, which takes away all the side effects of opioid, like nausea, vomiting, which is the common side effects, which again keeps the patient in the hospital.
So no morphine, and Sam gets to go home, and Mum and Dad will be glad to get him back.
To be able to bring him home after this, what is major surgery to a knee, in my eyes anyway, and to be at home and have the comfort of home. And if the pain relief works as it should do, then, he'll be comfortable, and that's the main thing.
Other hospitals are already lining up to learn about Hull Royal Infirmary's new pain relief trial, and that's because, if it's successful, it could numb the pain of the NHS's critical cost savings. Crispin Rolfe, BBC Look North, Hull.
That's fascinating stuff. Sam had his operation this morning. We wish him well, and I've just heard that he's already home. Absolutely amazing. Thank you for watching.